Today is January 5th, 2025, and let's delve into a new approach for a common dental concern, the interdental papilla loss. You might not have thought much about those tiny bits of gum between your teeth, but they're pivotal for both hygiene and that perfect smile. When these papillae disappear, it leads to those unwelcome black triangles, affecting both self-confidence and oral health. Hyaluronic acid, or hyaluronic acid, is emerging as a game changer here. This substance, naturally found in our bodies, is known for its impressive capacity to increase tissue volume and bind water, making it an ideal solution for restoring lost papillae. For anyone dealing with this issue, hyaluronic acid offers a less invasive alternative to surgery with lasting effects between 6 to 12 months. Researchers have recognized it as a frontrunner in non-surgical aesthetic dentistry, offering renewed hope for those seeking to regain both function and aesthetics in their smiles. Understanding the underlying science, hyaluronic acid acts as a filler by promoting tissue regeneration, a process already applauded for its anti-inflammatory properties, a boon for dental health. As we embrace these advanced techniques, we continue our journey towards not just better health, but sculpting the confidence of a brighter, fuller smile. Remember, a smile is a doorway to someone's world. Let's keep it inviting.